Hi guys, welcome to my YouTube channel. So today we'll be discussing the FMT important topics. These are basically for your MBBS theory exams, and I've written these topics in a very concise way in a chapter wise manner so you can have an easy access to those important topics. Also, these are enough. I have written them down from various sources and I've written down most of the important topics, so you need not go to other sources. And these are the two books of FMT, that is the Gautam Biswas latest edition competency based, and this is the Ready also competency based, the newest edition. So you can refer to these two books. And also there is a Chand book for FMT that is also good for exam purpose, and I have used Gautam Biswas for my exams. So let us get on with the PPT. So the first chapter, that is the medical jurisprudence and ethics. In this topics, this is a important topic because lots of MCQs and lots of short notes can come from this topic. So functions of MCI, that is the Medical Commission of India, functions of State Medical Council, duties of doctors and professional secrecy, privileged communication. Now this is an important topic, that is the professional misconduct, that is the infamous conduct, and its penal erasure and warning notice. Basically you'll get a question on infamous conducts. There are mnemonics to learn this, and I'll be discussing the topics soon. On each of these topics I'll make a video and upload it on YouTube. So in infamous conduct, it is important, and as well as its punishment, that is the warning notice and the penal erasure, that is also important. It is asked in Viva also. Professional negligence, that is the malpraxis. So you might get a question of malpraxis and you may confuse it with infamous conduct. So please don't make this mistake. I made this a mistake in my exams. So malpraxis is basically professional negligence. Now you can also get a difference between the professional negligence and infamous conduct. I'll be also making a video in which all the differences of FMT, like all the differences, all the tables, all the major diagrams, I'll be discussing those and making a video of that also, and uploading it on YouTube. So you can pause these videos and take the screenshots of this PPT, and I'll also be providing this PPT in my Telegram channels. You can go and click the channel link in the description box. I've uploaded it there, and you'll also find many other notes in my Telegram channel. So I hope you join it. So let us get on with it. The vicarious liability, that is respondent superior, and consent is a very important topic in your theory exams. You can have the questions like, what are the types of consents, what is informed consent, what is the medical legal importance of the consents, what are the consents which are false, which are invalid. So invalid consent is a very good question. And what is the proper age of consent? So consent is a very important topic. Now there's difference between civil and criminal negligence, that is also a very good topic to give. And prevention of negligence, safeguards against litigation, and defense against negligence. These are two very confusing topics. And question a question came in my exams in this one, and I wrote this one. In this topic, that is the prevention, you have to write that there should be proper staff, there should be proper training of the skilled persons. And in defenses against negligence, there is another set of answers. So please don't get confused in these two topics. The next topic is res ispa locator, contributing negligence, novus actus intervenes. These are just one or two line topics, and basically the MCQs come from this. So this is for the MCQ purpose. Then doctrine of common knowledge and therapeutic misadventure and hazards. It's an important topic, and you can get a short note or an MCQ on this. Also, the last topic of this chapter is the euthanasia or the mercy killing, in which you can get what is active killing and what is passive killing, and what is the euthanasia method in India. So these are all the topics in the first chapter, that is the medical jurisprudence and ethics. So let's get on with the next chapter, that is the acts related to medical practice. So in this there are acts like Transplantation of Human Organs Act, Consumer Protection Act, Medical Termination of Pregnancy Act, Preconception Prenatal Diagnostic Techniques Act, Protection of Children from Sexual Offences Act, and the Mental Health Care Act. In all of these, the most important topic will be Transplantation of Human Organs Act. It is a very very important topic and can come in ophthalmology also and other subjects also. This is a very important act, and make sure you do prepare this topic. So the next chapter is legal procedure. This is also very good uh, chapter in which many MCQs and many short notes and many long questions can also be framed. In this, there is inquest. You have to read the full inquest, all the types of inquest, and the magistrate and the police inquest difference is very important, and lots of MCQs can come from this. Then there are courts of law and their punishments, and how they are uh, stated, like the district court, the high court, the supreme court, all these courts. What is the capital punishment? Summons is a good topic. You have to read the full this topic, and conduct money. This is a very 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 important topic, and it will come in your exam. That is the difference between dying declaration and dying deposition. A lone short note on dying declaration can also come in your exams, but this topic is very 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 important. I've put a lot of stars in this because it is a must know topic, and it will obviously come in your exams. Then there are exceptions to oral evidence. It's a read topic. And witness is a very important topic for MCQs. There are so many types of witness, and especially hostile witness is asked very much. Then perjury MCQ will come. What is cross examination? What are leading questions? All this comes in MCQs. And duties of doctors in a witness box. It's a read one. So this is all for the legal procedure chapter. So let us get on with the identification of the chapter identification. It is a very important very important chapter, and also a lot of spotters in FMT. I'll be making a video on spotters also, so make sure you subscribe to my YouTube channel because I'll be making a lot of videos on FMT. So identification, corpus delicti, an MCQ comes. What is corpus delicti? And cephalic index, also an MCQ purpose topic. And intersex, not so important, just read it through. The sex topic in the identification chapter is just a read one. Age determination. Now age determination is a topic which you should not miss. It's a must know topic. How will you determine age? By dentition, by teeth. And Gustafson's method is also among this topic only, but it comes as a separate question. It can come as a separate question, so I have written it below it. And it's a very important, very 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 important, age determination by dentition and age determination by x-rays. Now there's age determination by mandible also, and that is also very important. So this all is very important, and this comes in your spotters, like a pelvis or a skull or a mandible will be given, and you'll be asked in your viva what is the difference between the male and the female pelvis, skull or mandible. Then there is medical legal importance of age, medical legal importance of scars and tattoo marks. This is a read topic. And fingerprint, it's a good spotter question. One of the fingerprints pattern will be given, and you have to identify it. There is difference between human and animal hair. Oh my god, this is a very 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 important topic, and it will 100% come in your exam. That is so important. And then there is difference between antemortem and postmortem plot. Preservation of viscera, it is more of an MCQ type of topic, but you have to read it. It's good. Then autopsy, what is positive autopsy, negative autopsy, and obscure autopsy, and exhumation. So this is all in the identification chapter. So I've written it in a very concise way. These are so big chapters, but if you'll see, like, only okay, these are the only topics which I have to cover in this chapter, so I'll think you'll be more motivated. Then comes forensic psychiatry. It's a very 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 important unit in your FMT. It is a very important unit. If you have to revise your FMT, I think you should start with forensic psychiatry. It's a very important unit. So delusion, hallucination, these are all very good topics, and all the types you have to know, that what are the types of delusions, what are the types of hallucinations, the difference between illusion, hallucination, what is impulse, what is the difference between psychosis and neurosis. A very good viva question, and it can also come in your exams. Lucid interval, it's a very good question. Difference between lucid interval and insanity and head injury. Then difference between true insanity and false or feigned insanity. Very, 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 very important questions. Please don't miss the important tables in your FMT, as many different tables are asked. Then schizophrenia, somnolentia, somnambulism, these are all read topics. Then civil and criminal responsibilities of an insane person. This is a very important topic. Please do not miss all the topics in which I have put a star mark. These are the must know topics, and I will be also uploading a top 50 or top 60 questions of each subject, and basically FMT also. Please make sure you do those topics just before your exams. These are very important topics. So the star mark, civil and criminal responsibilities, in which you can also be asked separately about the section 84 IPC and McNaughton's rule. So this is all about the forensic psychiatry, a very big chapter, very big unit, a very good and very scoring unit. So please make sure you don't skip this unit. Then comes a little small chapters, that is the erectile dysfunction and sterility, and virginity, pregnancy and delivery. These are small topics and yet an important part of your FMT subject. So impotence, sterility, frigidity and cord. These are the MCQ points. You have to know the definitions of these. What are the causes of erectile dysfunction and sterility in males? Causes of impotence and sterility in females, vaginismus, sterilization, artificial insemination and surrogate mother. I think overall this chapter is not so important. So in virginity, pregnancy and delivery, hymen types, all the names, cause of ruptures and medical legal importance. Read topic, difference between true virgin and false virgin, a very, very good topic and very scoring topic. You have to do this. Presumptive, probable and positive signs of pregnancy. This is also an important topic as per your viva also. And phantom pregnancy, a read topic. Superfecundation, superfetation, and its MLI. Very, 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 very important topics. It will be asked in your exams. It will be. It's a so good and so important topics, and it's so confusing, super confusing. So this is a very awesome topic. You have to do it. It's a must know topic. Signs of recent delivery, must know topics. It's frequently asked. Okay. And difference between nulliparous and parous uterus, very frequently asked. So as you can see, it's a very small chapter, but these four questions, these are the must know topics. And so this is a very scoring chapter and very small. So if you are doing nothing and you just want to complete FMT, make sure you do this small unit because it's very scoring and one question will obviously be asked from this topic. So now let us move to sexual offenses, a very good unit. And yeah, classification of sexual offenses. It's a okay, read topic. Rape definition, section 375 IPC. Punishment, that is 376 IPC. Very important, very important. Will be asked in your viva that what is section 375, what is the definition of rape, and it's a very good detailed definition. So you have to know what is rape and how to define it, what all things are mentioned in that definition. You have to know this. So what is custodial rape and statutory rape? These are the MCQ topics. And duties of doctor in rape cases, okay, important. Examination of rape victim and survivor, yeah, for practical purpose also important. Rape kit and safe kit, okay, it can be asked, but okay, it's not that important. Locard's exchange principle, yes, it is important. You have to know what is this. Examination of rape accused, not so important topic. Incest, okay, not so important. Sodomy, burglary, it's a read topic. Lesbianism, sexual paraphilias, all the types you have to know. You just a basic definition कि अच्छा ठीक है ये होता है ये होता है. Sadism, lust murder, masochism, transvestism, voyeurism, exhibitionism. These are just कि आपको पता हो कि definition क्या है इसकी. What is this? बस that is. So this was about the sexual offenses. It's a very big unit, but I have covered it only in one slide. So as you can see, you can cover it easily. It's a very big topic. Like in Biswas, it is given like sexual offense 1, sexual offense 2, sexual offense 3. There are 3 chapters, but you have to basically focus on this. Okay. So now let's come to injuries. Injuries is also a big topic. and it combines of the firearm injuries, heat injuries, cold injuries, and normal injuries, so head injuries. So this is a very big unit and it's very cumbersome unit, but I have written down only the important topics, and I hope you just complete them. So grievous hurt, you have to know what is grievous hurt. It is a frequently asked question in your viva, and if you don't know this, you'll not pass. This is a very important topic. You have to know what is grievous hurt, how many types are there, and what is there in each number. So seat belt syndrome, not so important. Joule burn, yes, it's important, you have to do. Spark burns, classification of thermal injuries, immersion syndrome, drenched foot, I think it's important, yes, you have to do it. Heat cramps, heat exhaustion, and heat stroke, heat prostration. So these are little confusing. I hope you read it and you'll remove your confusion that what is what. It's an important thing. But the most important in heat injuries is burns. It's must know topic. It's so important. Burns is so important. The causes of death can be asked of us like a separate question. What are the causes of death in burns? So you have early causes, immediate causes, late causes. So the cause of death is very important. Examination of a burn person, postmortem examination, Wallace rules of nines, classification of burns, pugilistic attitude, difference between pugilistic attitude and rigor mortis, antemortem and postmortem burns defenses, and difference between dry heat burns and wet your moist burns. It's very important. So this is all about the heat injuries. So next injury, as said, that injury is a very big topic. Skull fractures, you have to know all the names. It's an important topic. Coup and counter coup injury. Extradural hematoma is okay, it's important. It is more important than subdural and subarachnoid, so make sure you do this one. Okay. Abrasion, bruise, these both topics are very big, and you have to read it all. You have to read the full abrasion, you have to read the full bruise and contusion. Okay. Then there's separate question can be asked on what is ectopic bruise. MCQ can also be asked what is patent bruise, or you can also have a question like what is the railway line, what is tram line. So don't confuse yourself with the word. It is just patent contusion or patent bruise. So this is a must know topic. It's an important one. So difference between antemortem and postmortem bruise, difference between postmortem lividity and bruise. So this is also important. Incised looking lacerated wound and lacerated looking incised wound. So you have to know the definition, what is what. Incised wound, chop wound, stab wound, just know the definition. Fabricated wound, it's can be asked, it's an important topic. What is rifling? Important. What are the bullet? Only the names, ricochet bullet, and yeah, you have to know it. Cartridge of bullet and shotgun, very important. It spotter also, and diagram purpose also, and it can be asked in your exams. It's a very good and important topic. Components of gunpowder, MCQ based. Abrasion collar, MCQs. Characteristics of shotgun wounds at varying distances, yes, a very important. Close contact पे क्या होता है, far contact पे क्या होता है, ठीक है, तो it's an important one. Purpose rule, MCQ purpose. And difference between entry and exit wounds, it's like the most important topic in the full FMT. So you have to do this difference table. Okay, so it's a very important. In this slide you have to do the mainly the star marked questions. It's very important. Okay, so let's come to asphyxia. In asphyxia, it's an overall a very important topic, and one question will obviously be asked from asphyxia, and it has three major long answer question, that is the drowning, strangulation, and hanging, and it's very important. Okay, so causes and classification of asphyxia deaths. Postmortem findings, hanging, as you can see, so many star marks, very important. Difference between antemortem and postmortem hanging. Lynching and judicial hanging, MCQ purpose. Difference between hanging and strangulation, very important. cafe coronary syndrome, immersion syndrome or sub-immersion inhibition, and post-mortem examination of a drowning case, and you have to mention all the antemortem signs in that drowning case, difference between freshwater and seawater drowning, Gettler test, diatrim test, and sexual asphyxia. So asphyxia is a big topic, but you have to just focus on hanging, strangulation, and drowning. Okay. The next unit comes, that is death or thanatology. In this, you can see the changes after death, that is the immediate, early, and late changes. What is tachynoir, what is alcor mortis, what is lividity, that is hypostasis, difference between hypostasis and bruise, important. Rigor mortis, very important. Difference between rigor mortis and cadaveric spasm, very important questions. Heat stiffening, putrefaction, order of putrefaction, MCQ purpose, Casper dictums, MCQ purpose, adipocere, very important question, mummification, important, brainstem death, very important. If you have to do brainstem death and this rigor mortis and cadaveric spasm, it's a must know topic. Okay, so if you are short of time and you don't have the time to cover everything, just do brainstem and rigor mortis and cadaveric spasm. Okay, and adipocere, it's a very important. देन यू हैव टू नो कि यार कॉज ऑफ डेथ क्या होता है, मैनर ऑफ डेथ क्या होता है, मोड ऑफ डेथ क्या होता है, एंड सडन डेथ क्या होता है. तो बेसिकली द डेफिनेशंस ऑफ दिस. सो दिस इज ऑल अबाउट द डेथ और द थैनाटोलॉजी यूनिट. Now let's come to infanticide and child abuse and the others leftover topics. In infanticide and child abuse, you have to know the rule of Hasse, the difference between live born, dead born, stillborn fetus, all the signs and all the causes. So this topic is one topic which will be asked. This is a very small unit, like that virginity, pregnancy and delivery topic. This is a very small unit and it's a topic from which question is 100%ly asked. Hydrostatic test, causes of infant death, precipitate labor, battered baby syndrome, very important, sudden infant death syndrome or cot death or crib death, shaken baby syndrome or infantile whiplash syndrome, and Munchausen syndrome by proxy. So these are only the topics which you have to cover from this subject, this chapter. And the battered baby syndrome and the live born, dead born, stillborn, these two are the most important topics that you should not leave out while giving your theory exam. Battered baby syndrome is a very frequently asked questions, and this one too. So in this chapter, these are the questions. There are some few chapters, like small chapters, so you can find these topics in the appendix, like postmortem artifacts. You have to just know the names, but the therapeutic and resuscitation artifacts can be a short note by itself, and it is a very important topic. So transportation injuries in this road traffic accident, and the primary and the secondary impact injuries, the examination of a postmortem examination of a road traffic accident person, this is all important because it came in my theory exams. Another is confirmatory test for blood, that is Teichmann and Takayama crystal test, and these two tests are basically amongst the spotters also in FMT spotters. So and this is important, and also the precipitant method, which is the species identification test. So these both were asked in my viva also, that what are the confirmatory tests and what are the tests which are used for species identification. And the medical legal application of blood groups, that is civil and criminal cases, it's a read topic. So this is all for the general FMT or the forensic medicine part. For toxicology, there will be a part 2 of the important topics. So this is all the chapters. I hope you like my PPT, and this will be available in my Telegram channel. The medical jurisprudence and ethics, acts related to medical practice, legal procedure, identification, and forensic psychiatry, erectile dysfunction and sterility, virginity, pregnancy and delivery, sexual offenses, injuries again, asphyxia, thanatology, infanticide and child abuse, and the others. So it's a very concise PPT in which all the important topics have been mentioned. You need not go to any other source. This is enough for your theory exams. Thank you and have a nice day.